Today I'd like to provide our daily update on COVID-19 testing and hospitalizations and share some details around our strategy to assist nursing homes across the Commonwealth. With respect to testing, Sunday's report recorded 9,255 tests conducted in Massachusetts. The number of new confirmed COVID-19 cases came in at 1,590. That represents a 17% positive test rate on the tests that were processed and released yesterday. We've now conducted about 236,000 tests. We have about 55,000 positives, which represents a positive test rate of about 23%. We obviously pay a lot of attention to that number as well as to the hospitalization numbers that we report on here daily. As of April 25th, there were 3,879 patients hospitalized statewide for COVID-19. That's a small increase over the previous day. As we've said before, a big part of our assumption about social distancing and essential business operations and stay-at-home advisories was all about taking the verticality out of the peak, the run up to the peak, and we clearly have done that. We flattened the curve, but the flat curve basically means it's been riding up like this for a while. It seems to have plateaued depending upon which part of Massachusetts you're in, and then the hope and the expectation is it will start to fall, but it will probably fall slowly the same way it ramped up slowly. Currently, about 7% of those who test positive require hospitalization statewide. The state's hospitalization rate has remained relatively stable, somewhere in that 7 to 10% range for the past week or so. Massachusetts hospitals, I think as everybody knows, significantly increased their bed capacity and now have about 18,300 beds available across the state, including the temporary field hospitals. 56% of those beds remain available to patients. And I do want to point out that on the call, we do a daily call with hospitals here in the Commonwealth, and I do want to point out that several of them said that they were seeing an increase in some of the activity that did not involve COVID-19, which we view as a positive sign. As I said last week, the folks at Bay State Medical Center last week had about 150 COVID-19 patients in their hospital. They also had 400 people who were there for other reasons. I think the numbers across our hospital community would be relatively consistent in the sense that they continue to do many things for many people that don't have anything to do with COVID-19. And while we pay a lot of attention to this data because it's critically important to our ability to make sure that we can deal with the COVID-19 population as that population surges and plateaus, we continue to have significant capacity across our healthcare and our hospital system. And if people are sick, they should reach out to their clinician. If they're deeply concerned about their health status, they should definitely go to the emergency room. There are people there who will treat you and take care of you.